Everyone, welcome to Plants and Politics. This is Gina. Some new findings have come out from a study on COVID patients, and it's kind of scary to say the least. So the study looked at 100 patients, and they had a median age of 49 years old. So these are not elderly patients, but most of the patients that they reviewed, most of these 100 patients were either asymptomatic or they just had very mild symptoms of COVID. And they performed MRIs on their hearts. And this was on average 2 months after they were first diagnosed with COVID. What they found was that 78% of these people had ongoing heart abnormalities, and 60% of them had inflammation of their heart muscle, which is myocarditis. This was very concerning, of course, and what they found too was that it wasn't related in any way to the severity of their illness or how long that they had had the illness, how long they had COVID. And again, some of these people were asymptomatic, so they had no symptoms whatsoever. So the findings were published in the Journal of the American Medical Association. And what they said was that, this is very concerning, especially for younger people, because they are the ones typically who aren't going to have strong symptoms, or they may even be walking around asymptomatic. But they talked with a doctor, and what she explained, this is a physician by the name of Holly S. Anderson. She's an attending cardiologist at the Ronald O. Perelman Heart Institute and the New York Presbyterian Hospital. What she said is that the coronavirus can affect the heart directly and indirectly. So it can, as she put it, it can invade the heart muscle cells, causing the inflammation, which is the myocarditis. And this reduces your heart's ability to pump. So obviously, not a good thing if your heart isn't pumping properly or regularly. She also said that the virus can cause damage by forming blood clots in small blood vessels of different organs, various organs, including the heart, and that can lead to lung disease and put a strain on the heart, of course, and it can also put a strain on your immune system, which causes damage to your organs. And so what they're warning about is that, this can result in heart failure and sudden death, even though you have no idea. You may not even know that you have these issues. So if you have been diagnosed with COVID, or even if you haven't and you're feeling tired or you're feeling short of breath and getting fatigued really easily, definitely get in to see a doctor, because you may have been exposed, you may be asymptomatic, and this may be affecting your heart. And again, this is something that's going to affect younger people more so, because they are the ones who are not having the most severe COVID symptoms. And so you may think that it's just a common cold, or you may even know that it's COVID, but it's not that big of a deal until, sadly, dropped dead of a heart attack because you had a heart condition that you weren't even aware of, which was related to your COVID. And another thing that was very scary that they mentioned is that the incidence of cardiac arrest, so heart attacks that were not, when the patient was not in the hospital, went up by 400% in the first week of April in New York City compared to the same period of time in the previous year. So they know that people are dying from this. People who are not getting treatment, a lot of people either don't go to the ER because they don't want to get the virus. They figure it's a hotbed for COVID, but other people don't go because it's expensive, because they know they're going to get hit with a bill for potentially thousands, tens of thousands, hundreds of thousands of dollars if they are admitted. I mean, that's a sad fact in our country because we don't have universal health care. So a lot of people just don't go, even if they're not feeling well. They just don't go. So very scary news, guys. If you're a young person listening to this, if you have symptoms, go in, get treated. I get it. I get that there's going to be a bill, but better that you have a bill that you have to pay off in some way than to lose your life. So just wanted to bring you guys that news so you're aware of what's going on and you get out there and get treated quickly and sooner rather than later. As always, like, share, subscribe. I'll talk to you guys soon. Take care. Thanks for listening to Plants and Politics. The only way we can take our country and power back is to spread the truth and build an army. So remember to like, follow, subscribe, and share on Facebook, YouTube, and wherever you listen to your podcasts. Thanks again.